breakfast this morning?
Eggs.
Eggs? How about pancakes?
It's Saturday morning at the Pressey home.
A little bit more.
As the sun rises, breakfast gets started.
Tuck this in for me. All right.
Naomi Pressey decides she wants to help.
Make sure you eat it all. Thank you, Naomi.
And that's when things can sometimes
Put them in the right.
get out of control.
Naomi, hold on. Okay, if you don't dump it in there, let Daddy measure it out first, okay?
Naomi is 6 years old.
Not that.
And even the simple task of putting away silverware in a drawer is a challenge.
The result was silverware was scattered all over the place.
Everyday tasks are a challenge for her.
Which is difficult for Stephen and Jennifer Pressey, who have to balance their time with their two other daughters, an 8-year-old and a 2-year-old. Yet Naomi requires the most attention.
Oftentimes, it feels like I have another toddler, a 6-year-old toddler.
And just like her baby sister, Naomi isn't potty trained and wears diapers.
She understands the different steps, but she doesn't understand her body signals.
Which is why Naomi depends on her parents to figure out if she needs to be changed.
Need diaper change?
No.
But even though Naomi says no,
You stink!
her parents still have to check.
You can tell mommy when you have a poopy diaper. You don't have to sit here in it,
Naomi doesn't communicate if she's having issues,
Yeah, it's bad.
which is why she relies on her parents to determine all of her needs, including if she's getting enough oxygen.
64. That's not good.
She just has oxygen drops, hypoxic episodes, we were told, and she just needs oxygen.
Naomi also has a difficult time swallowing and blowing her nose,
Not through your mouth.
so she uses a suction machine.
She has trouble managing her secretions, so she's really kind of gurgly and wet this morning. She likes to help because then she feels like she's in control of what's happening to her body.
Everything is a struggle,
Alright,
even focusing to get dressed.
let's put your shorts on first, dude.
It's a team effort for Stephen and Jennifer to help Naomi and to figure out what she needs.
Just you remind her to do everything, and you just have to be on top of it. Girl, we're gonna eat.
This morning, the Presseys wonder if Naomi will eat.
That's the hard part with her. Everything depends on the day.
And while everyone in the family is excited about pancakes,
Pass the syrup, please.
Naomi needs to be reminded to eat.
Alright, let's count our bites. 1. Chew it up really good.
A lot of it, I think, has to do with the trouble that she has swallowing. She has trouble choking. She has trouble pocketing food in her mouth.
You still got some food in your mouth. Swallow it all up.
Naomi also doesn't have the fine motor skills to hold a fork, so her dad has to feed her.
You definitely have to monitor and make sure that she's getting the calories that she needs to get.
To help with this,
So this is her G-tube button.
Naomi has a gastric feeding tube.
Sometimes we'll go through huge stretches of time where she won't eat anything by mouth that will sustain her, and then she's like completely dependent on her G-tube. Her milk goes through her button, meds go through her button, we can push fluid through her button using either a syringe or bolus feed.
This morning, Naomi is just getting her meds.
So now we just do a series of pushing the meds in her tummy. She's on Keppra every day, and that helps control her seizures. She's on Onfi, which helps control her seizures as well. And all these will go in her tube.
Yet medications are not enough to control Naomi's seizures.
She has a vagus nerve stimulator, which is like a pacemaker device that's implanted in her chest, and then there's little wires that go up her neck that help regulate her electrical activity in her brain.
Because her seizures seem to happen mostly at night, Naomi sleeps in a special medical bed in her room.
This side comes all the way up when we need it to. We are concerned that she'd either fall out of bed or be disoriented and try to get out of bed and hurt herself.
The bed allows Naomi to easily be hooked up to medical equipment if needed.
It has an IV pull on it so that we can hang her feeding tube from it at night.
There's also an oxygen machine, a heart rate monitor, and a respiratory vest nearby. Depending on the day, Naomi could use all of these things, which is why the Presseys keep a close eye on her.
This is a video baby monitor. She's been known to have a lot of seizure activity in her sleep, or if her machine's going off or something's going on at night, we can more easily monitor her.
Naomi's seizures, along with her other issues, are all due to a brain injury she sustained soon after she was born. It was February 6, 2008.
So she was born to term, a good chunky 8 pounds, 15 ounces.
But doctors and nurses noticed that something wasn't quite right with Naomi.
Kind of a whirlwind because next thing I know, they're telling me, well, we think something's up with her heart.
Naomi was diagnosed with a coarctation of the aorta, a treatable congenital defect where part of the heart is more narrow than usual. It was decided that Naomi needed surgery, and she was airlifted to Children's Hospital in Denver. While she was being prepped for surgery in the operating room, Naomi had a cardiac arrest.
According to the records, it took about 30 minutes before they really reestablished a heart rate of any functional value in Naomi.
I just remember just sobbing, Lord, just whatever it's gonna be, I don't care, just please don't take her.
30 minutes without oxygen caused Naomi to have a brain injury.
During this time, she had poor circulation to the brain, better known as ischemia. She also had lack of oxygen delivery to her brain, known as anoxia. So she suffered basically what would be called an anoxic encephalopathy, or brain injury due to lack of adequate oxygen and nutrient delivery.
Pediatric neurologist Max Wisnitzer, MD, says there were signs that Naomi had a brain injury soon after she had a cardiac arrest.
We know that she had evidence of brain injury because she had seizures. And seizures can be a marker of this acute encephalopathy or acute brain dysfunction that occurred.
And as Naomi's brain develops, the consequences of this injury become more apparent.
And we've had time to follow her over about the last 6 years or so. She's basically gradually evolved and told us what the consequences of this injury are. Take your hands and push me away. Push. Good job!
Dr. Wisnitzer recently examined Naomi and says there are several areas where she has limitations.
Hold your head up. She's not doing things that you would expect typical 6-year-olds to do. And she also has evidence of motor problems. And when we say motor problems, which means how does she move in space? How does she move with her body?
Put your feet up there. Okay, go ahead. Push.
It's especially obvious when Naomi attends her gymnastics class.
I think the hard part is everything is just 10 times harder for her to do.
Push, 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 push.
Dr. Wisnitzer believes this is due to her cerebral palsy.
She shows problems on the right side, which are the equivalent of a stroke. She has what we call a right hemiparesis. She has a significant weakness on the right side of her body.
Reach.
Which is why gymnastics is much more challenging for Naomi.
Okay, walk across the beam.
To walk on a balance beam, you've got to maintain your balance, as well as move your body fluidly in space and smoothly in space.
Okay, put it back out.
She can't do that. She moves much more awkwardly, much more jerky.
Flip!
And one side is much more impaired than the other, which no matter how hard she tries, doesn't respond to her signals and prompts. That tells us that she has to have damage on both sides of the brain. And just empirically, we know that it's probably worse on the left compared to right side.
Up!
Because her motor problems are worse on the right side of her body. Left side of the brain controls the right side of the body.
Naomi's limitations are not just physical.
Needs so much.
She has speech problems where her speech is simplified and more difficult for her to use.
Help me with.
She also has other issues that affect her learning from an intelligence standpoint. She's not reading, she's not doing age-appropriate math.
Naomi, this is number 1. Number 2. Number 3.
She has difficulties processing information as well.
Which one is number 2? That's number 1.
In her case, she doesn't understand the meaning of the reading function, and therefore she can't retain the information because her brain's not at that level yet in order to take that information and use it appropriately. She's functioning at about a 3-year-old level.
I know,
Naomi participates in several different therapies, including occupational and speech therapy. And she has also benefited from hippotherapy.
She loved horseback riding. That's when she started talking. Something with the horse and the therapy, that's when she started to have a vocabulary.
Dad, Mommy does.
Dr. Wisnitzer believes Naomi will continue to need therapy to help her grow.
Oh! There is hope for Naomi. I expect her to show further developmental progress, but the way she's going to get there is by help.
My shoe.
Help from her therapist, help from teachers, help from her parents, help from her doctors. What color is this?
Oh, yeah.
According to a life care plan developed for Naomi, the most significant need that she will require is constant attention because she is developmentally delayed and has poor communication skills. Therefore, her needs must be noticed by her care providers.
Hold still.
Dr. Wisnitzer agrees with these findings.
When she gets to 18 years old, maybe she'll function like a 9-year-old.
Do you function with this?
Her motor problems, her intellectual problems
Put this leg out.
will stop her
how
from
she-
basically functioning as a normal adult.
All of this is a result of her brain injury.
Naomi would have been a normal functional child, but would not be the way she is if she had not gone without oxygen for that 30-minute time period during her cardiac arrest.
Naomi's condition has forever changed the Pressey family.
Yes, my child has lifelong disabilities now. She has lifelong challenges. Our lives have been completely turned upside down.
You know, I wish things didn't have to be this way for her, and I wish there was something that I could do. It's heartbreaking to see that, you know.
Especially because Naomi's brain injury could have been prevented.
I want her to have the best life that we can give her.